So, my friend, thank you again for coming here, for finding us, choosing us. Please tell me your story. You have a varicocele procedure before?
Yes.
And it failed. What happened? How did you?
So in 2021, I had a varicocele surgery, but the doctor didn't did it 100% for me properly. So I don't know why. And I just visited many doctors in Iraq, and so they just all recommend me any supplements and surgery, but I didn't trust them. So I just searched on YouTube. So who's the best doctor in Turkey? That she just showed me Dr. Junaid Sevinch.
Thank you.
Then I just called the...
Did you watch our videos? Or?
Of course. I watched sometime before calling. I watched many videos. So how you arguing with the patients, and how you recommend surgery, how you do the surgery, and they all they all answered 100%. We just get rid of that varicose.
Yeah, our best advantage, most important advantage is we only deal with this procedure. I operate some more cases but they are maybe 10% of my practice.
Yeah.
But 90% of my practice is varicocele cases. And in a normal hospital, in a normal clinic, a urology doctor operates 2 varicocele cases in a month.
Yeah.
So they don't care or give too much attention to varicocele surgery. And varicocele surgery has some missing points.
Yeah, exactly.
And it is not clearly understood yet. I solved these problems. And the most important advantage is I am operating too much cases and have too much expertise on this and experience on this. So when you decided to come, we make a voice call, right?
Yeah, of course, yeah.
And you tell me your story, and I said, okay, it's good. And you came for a visit first, then go back and come back again. Yes. Why did you do like this?
Because I decided, and then I watched many other videos that you just published on YouTube. And then after the surgery, so the patients talked about how you contacted them, how you arguing with them. So in 2021 when I did my surgery, so the doctor didn't contact me, so when I asked for something, he said, yeah, go like this, yeah, go do this, and so he didn't tell me the things 100%. So do these things, don't do these things.
So but you want to be sure.
Yeah, I want to be sure. But you assure the patients that so what to do and what should you do or what should not to do anything. So that's why I chose you to do my surgery.
Yeah, and everything went very well. The operation.
Alhamdulillah, yeah.
For the second operations, it's always more tricky, more difficult, and healing is a little more complex. We put a drainage tube into your scrotum because sometimes when we do a second procedure, sometimes it is very easy, like a primary procedure. Mm-hmm. The tissues are not stuck to each other, and it is easily operated. But most of the cases, in a second procedure, the tissues are stuck. And when we liberate the testicle and deliver the testicle, there may be some bleedings. So, and these bleedings are in the scrotum, not in the incision site. So it's not possible to see them, or it's very easy to miss some of them. So we put a drainage tube in those cases. We did this to you, and still you have some edema. And related to this, you have some pain. How is this pain? How do you score the pain over 10?
So my pain was actually 6 to 7 out of 10. Okay. Actually, but so I know that time by time will disappear. I think because I've experienced that before. Like this.
And before the operation, what was your concerns? What was your symptoms? Did you have testicular pain?
Of course. So because of testicular pain, I decided to do a surgery, not because of the sperm counts or anything else.
Erectile problems or libido problems, did you have such things?
I think, a little bit I have it, I think.
Okay.
So then I decided to, because I have a lots of pain. I have been I have pain for about 4 years. Then and I want to decided to like get rid of it 100%.
Was it affecting your daily life?
Of course, like your mental health, I think. I mean, for example, you all every day, you daily think about how this pain goes away, how this pain like, and how can I fix that pain. So every day, and
so there's an issue. Normally, testicular pain has two reasons.
Yeah.
One is varicocele, one is prostatitis. So in each case, we look to the prostate if there is any inflammation. In your case, there is not a huge inflammation, but there is a moderate inflammation, and we cleaned it. So today we don't know if the pain was because of varicocele or if it was because of prostatitis. So if it was because of varicocele, the most possibly it is because of varicocele.
Exactly.
It's finished now, and it will never come back again. But if the pain comes back after 3-4 months, that means the prostatitis that we cleaned the prostate, but it will refill again. So in such cases, I call my patients back for a second visit and spare here 5 days to clean the prostate again. Or they can do it with their own. I have videos showing how to prostate massage yourself. How can you do it at your home? And there are also some instruments, how you will use them. So people coming from a long distance country, it may be difficult to come back again.
Yes.
And they can try it themselves. So if the patient get rid of the pain at the beginning of the procedure, but it came back, not 100%, but maybe 20, 30, 40%. It may be because of prostatitis. I want them to be aware of this and try the massage themselves. If it is helping, they will understand, oh, I made some prostate massage myself, the pain decreased, so it must be because of prostatitis.
Exactly.
There is an issue like this for the pain. Do you feel any change in the pain? I mean, you have edema now. You have the drainage tube inside, so they cause a lot of pain.
Yeah, of course. And I have a two-sided varicocele surgery and one drainage tube. So we can't decide right now. It's because of the varicocele, but I assure you, like after 1 month, I can assure you that the pain will goes away or not. So if it goes away, it was because of the varicocele. But if it's not, like it was because of the prostatitis, right?
Even I treated the prostatitis now. So after 1 month, it will disappear. It will disappear, but it will come back. If it is because of prostatitis, it will come back. Is it possible to come back for the varicocele? Yes, of course. You can have recurrence, which is very difficult for you. After first operations, recurrence may be possible.
Yeah.
Not in my cases, but still I have 3% recurrence. So if it was a first-time operation, primary operation, they had the risk of varicocele. If they have pain, go do a Doppler ultrasonography. If there is still a residual vein or recurrence, it may be because of that, of course. But most of the time, they will not have recurrence in my cases. And if they have pain, this is because of prostatitis.
Understand.
Yeah. So thank you for letting us discuss this.
Thank you so much.
And thank you for the video. Information, all we need is information from our patients.
Yeah, exactly.
And can you summarize how was the postoperative period? You are now at postoperative 5th day.
Yeah.
And you had a really difficult secondary operation.
Yeah.
And two-sided operation. So how did you deal with your pain issues? What did you do these last 5 days?
So I just like lied for about 5 days, because as you recommended for me, you don't have to like walk too much. So just eat and going to toilet and then came back. So just by your recommendation, I did all of these things and stuff. Yeah.
Okay. So afterwards, my only recommendation is do not strain for 4 months. don't strain and don't do anything that will need straining. Of course, in your age group, everybody is asking for fitness, gym things.
I know.
And okay, it's possible, but without straining. If you don't lift very high kilograms, you may not increase this abdominal pressure. You can do some fitness exercises, such things, but don't increase the abdominal pressure. This is the only concern out of this. Of course, for example, using a bicycle will not increase the abdominal muscle, but don't use it for 500 kilometers. Okay, it's just everything must be in normal amounts. Anything must not be extreme. Don't do anything extreme.
Thank you so much, doctor.
Yeah.
And
thank you.
Yeah, you're
Thank you,
welcome.
my friend.
So thank you so much.
Thank you.